My name is Melissa Deardahl. I'm the nurse practitioner for the Minnesota Reflux and Heartburn Center. I'm also the GI lab director along with one of the reflux specialists. I'll be talking with you today about the comprehensive reflux evaluation and all the diagnostics that go along with it. At the Minnesota Reflux and Heartburn Center, we like to do a comprehensive reflux evaluation. The diagnostics included in that are a variety, but the basic ones are usually an endoscopy, also known as an EGD or an upper endoscopy. This visually observes the esophagus, stomach, and duodenum. On the scope, there is also special lights, a narrowband imaging, which is a high resolution for the detection of Barrett's esophagus. Triple biopsies are also completed during the endoscopy. These typically include biopsies of the stomach for H. pylori, which is a bacteria that can cause ulcers. It's also looking for atrophic gastritis. Esophageal biopsies, the body of the esophagus, for eosinophilic esophagitis, along with biopsies at the gastroesophageal junction where Barrett's begins. There are additional diagnostics in regard to biopsies and looking into the tissues in regards to Barrett's. That is a Cellvizio, which is a confocal laser endomicroscopy, also known as PCLE, which is also the world's smallest microscope that can be utilized at the time of endoscopy. There is also Watts 3D brush biopsy that can be done in regards to Barrett's esophagus evaluation. Balloon distension study, also known as an endoflip, is a balloon with a computer sensors that gives real-time view of esophageal function. It also precisely measures diameter and pressures within the esophagus. Another part of the comprehensive reflux evaluation is ambulatory pH testing. Oftentimes, this is also done during endoscopy, where a capsule is left behind and you take home a recorder that you carry usually around your neck or on your hip. Does not have any cords or wires or anything that are attached. It's a wireless system. This study tells us if you actually have acid reflux or not. It's typically 48 hours, but we can do up to 96 hours. It tells us the frequency of reflux, the severity, and the pattern of the reflux. So daytime, nighttime, all the time. Another portion of the comprehensive reflux evaluation is esophageal manometry, also known as high-resolution manometry or HRM. This evaluates an individual's swallowing ability, detects esophageal motility disorders such as jackhammer esophagus, which is also hypercontractile esophagus, used to be known as jackhammer or nutcracker esophagus. It also helps us with ineffective esophageal motility, which is poor motility of the esophagus. There are also other disorders such as distal esophageal spasm and different types of achalasia. It is an essential test to evaluate difficult swallowing, atypical chest pain. We do have a lot of patients that have been to the emergency room feeling as though they've had a heart attack. Once a cardiac evaluation has been ruled out, they are often referred to our center and is often reflux disease or, as I'm saying, a motility disorder. So that concludes the basic comprehensive reflux evaluation: the endoscopy, the biopsies, the ambulatory pH testing, and the esophageal manometry. Certainly we have additional tests in our toolbox that we can use for further evaluation. After your comprehensive reflux evaluation has been completed, we typically have you return to the center within a couple weeks. We also know that people travel from a distance to our center, therefore we also have telehealth Zoom visits available in which you are still able to see and review your diagnostic testing. Telephone is also available too. This is a bit more challenging just because we aren't able to show you your tests and results, but we certainly can talk you through them. Reflux is a lifelong disease. Therefore, we like to talk about best life plan for treating your reflux. Treatment options typically include lifestyle diet modifications, medical therapy, endoscopic and surgical options, along with follow-up visits to assess success of your treatment, along with surveillance should you have Barrett's esophagus or just reflux in general, as it is a progressive disease. I appreciate you watching today. I hope you found the information useful. Thank you.